Dr. Shayesteh is here to talk about something I think a lot of us like, which is sugar, but the difficulties that can come with it with heart disease.
Josh, this is very important research. For the first time at the national level, this research connects how much sugar, especially processed sugar, we eat for the risk of developing heart disease and actually dying from it. Now research shows that person that consume, for example, 25% of daily calorie from sugar, they have twice as much more risk of dying from heart disease than somebody consumed less than 7%.
What can we do to try and eliminate some of that?
It's interesting that this is the general recommendation, Josh, for men. They're recommending no more than 9 teaspoons of sugar for men and 6 for women. American Heart Association actually recommend less than that. However, average intake of sugar is 22 teaspoons in the United States. And Josh, more important, now the recommendation for kids depends on age factors, 3 to 5 teaspoons of sugar per day. They consume over 32 teaspoons of sugar per day. So it's amazing that how much sugar we consume. And this research clearly for the first time connects these two together between how much sugar we consume and risk of heart disease. The question is where we are getting this sugar. It's very simple, Josh. Just consume a can of a pop adds up 10 teaspoons of sugar in our diet, and extra donut, another 3-4 teaspoons, and you can see it adds up. The question is how sugar, for the first time that this connection is built, causes heart disease. Now research shows that, Josh, by consuming too much sugar causes abdominal belly fat gain, which leads to a condition called insulin-resistance. This actually significantly increases risk of developing type 2 diabetes, cause inflammation. Both of them are risk factor for heart disease. And interesting, now research shows that insulin resistance leads that the body produces less good cholesterol, more of a bad cholesterol, especially small particles that are more dangerous when it comes blocking the arteries and increase the triglyceride level. And at the same time, blood pressure. The combination, significant risk of developing cardiovascular disease. The question is, Josh, we don't need to be consuming sugar-free diet, but there are two types of sugar. One is natural and one is processed sugar. We want to cut down the processed sugar. And one of the best way to do that is actually reading the label. If anything basically we're buying has more than 5 grams of sugar, that's a red line. If you're buying yogurt 26 grams of sugar, that's not a natural sugar. A glass of skim milk has 12 grams of sugar, but flavored milk has 26, so that simply means added sugar. And it's very important that people pay attention because they hide these sugar, read the ingredient, for example, in this case, cane juice, high fructose corn syrup, even brown rice syrup, and even other terms they use to hide the sugar. So reading that label is very critical because cutting down sugar from our diet extremely important because for the first time connecting heart disease, which is, Josh, is the #1 killer for men and for men and women in the United States.
How big is it for parents to reach out at a young age for their children and be aware of those labels? That way it's eliminated at an early age.
Actually, very important point, Josh, you brought up because this research shows that independent actually from age, independent of weight, and even diet, just consuming extra sugar is dangerous for all of us. So cutting down the processed sugar, one of the major sources of sugar in the kids' diet are basically pop, soda, say for example, pastries, even these, some of cereals are loaded with sugar. So read the label, keep the processed sugar under 5 grams, basically total 5 grams or less, and if there's natural sugar, that's perfectly fine.
And if we do that, the risk for heart disease is just
absolutely. It's amazing.
Lower.
This is because heart disease, Josh, is absolutely preventable disease. By changing small change our diet and lifestyle, actually you can actually put the stop on the development of cardiovascular disease. It's a preventable disease, basically.
Awesome, Dr. Shayesteh. Thank you so much. For questions or if you want to have a meeting with Dr. Shayesteh, call the number on your screen. Your first consultation is free. We'll be right back.